This oral powder packet is used to replenish fluids and minerals, like sodium and potassium, that are lost due to diarrhea and vomiting. It helps to prevent or treat dehydration, which is crucial for the body to function properly. The way to take Normalyte ORS 1.3-1.45-0.75 gram/10.5 gram oral powder packet is to mix the contents of the packet in water as directed on the product package. Stir until completely dissolved. Do not heat this product unless the product package states that it is okay to do so. Dosage is based on your medical condition and response to treatment. Remember not to drink fruit juices or eat foods with added salt while taking this product unless directed by your doctor. And tell your doctor if your condition gets worse, if it lasts for more than 24 hours, or if you also have severe stomach/abdominal pain, blood in the stool/vomit, a fever, or signs of dehydration, such as dizziness, decreased urination, severe thirst, very dry mouth, seizures. If you think you may have a serious medical problem, get medical help right away. If you experience mild nausea or vomiting, try taking this product slowly in small amounts with a spoon. If these effects persist or worsen, contact your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. However, be sure to seek medical attention if you experience any serious side effects such as dizziness, unusual weakness, swelling of ankles/feet, mental/mood changes, or seizures. Although rare, seek immediate medical help if you have symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, contact your doctor or pharmacist for advice. Before taking Normalyte ORS 1.3-1.45-0.75 gram/10.5 gram oral powder packet, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have certain health conditions such as difficulty keeping fluids in your stomach, trouble urinating, or intestinal blockage, it's important to consult your doctor or pharmacist before using this product. Additionally, if you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's crucial to talk to your doctor before using this medication, as it is unknown whether the product passes into breast milk. When taking Normalyte ORS 1.3-1.45-0.75 gram/10.5 gram oral powder packet, it's important to be aware of potential drug interactions. Certain medications or supplements may affect how Normalyte ORS works or increase the risk of side effects. It's essential to maintain a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this information with your healthcare provider. Do not make any changes to your medication regimen without consulting your doctor first. In particular, be cautious when taking mineral supplements, such as potassium, alongside Normalyte ORS. Always seek guidance from your healthcare professional to ensure the safe and effective use of this medication. If someone has taken too much Normalyte ORS and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. Make sure to attend all your scheduled medical and lab appointments. As you start feeling better, you can begin incorporating soft, bland foods into your diet. This can include items like rice, bananas, toast, boiled potatoes, or any other foods that your doctor has recommended for you. Normalyte ORS 1.3-1.45-0.75 gram/10.5 gram oral powder packet is used to prevent or treat dehydration caused by diarrhea or vomiting. It helps to restore the body's natural balance of minerals and fluids. This medication is typically mixed with a specific amount of water and taken by mouth as directed by a healthcare professional. It is important to take the correct dosage as prescribed. This medication is most effective when taken at the first sign of diarrhea or vomiting. Be sure to follow the instructions on the package and consult a healthcare professional if you have any questions or concerns. Make sure to check the storage information on the packet before using. If you have any questions about how to store it, ask your pharmacist. Keep all medications out of reach of children and pets. Do not flush medications down the toilet or pour them into a drain unless told to do so. When the product is expired or no longer needed, dispose of it properly. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.